The Select Subcommittee on the Coronavirus Pandemic will come to order. I want to welcome everyone. Without objection, the chair may declare a recess at any time. I now recognize myself for the purpose of making an opening statement. Today, the Select Subcommittee is holding a hearing to examine the role of both infection-acquired or natural immunity and the therapeutic acquired or vaccine-induced immunity. It should have and could have played in the public health response to the pandemic, and concerns as to why the federal government decided almost wholly to ignore at least the natural immunity. In the earliest stages of the pandemic, COVID-19 was a novel virus, and there simply was no data. Again, we are not here to negate the significance of that unprecedented time. But as data changes, so must our decision-making based on data. And as time passed, more and more global research emerged that infection from COVID-19 produced robust, naturally acquired immunity. Let's be absolutely clear. Natural or infection-acquired immunity is real. It's been known for hundreds, if not thousands, of years. Dr. Fauci himself even said so in 2004. While speaking about the common flu, he said, quote, "The most potent vaccination is getting infected yourself," end quote. And yes, the flu and COVID-19 are different, but the science regarding immunity is the same and should be respected. However, instead of following the science, public health leaders ignored the facts and mandated vaccines for Americans without any regard for a previous infection and immunity that may come from that, and did so with the threat of losing one's job. Nowhere in this process was there an opportunity for one to confer with their doctor, who they know and trust, to discuss risks and benefits to their health. This is part of the reason we are here today, to ask why naturally acquired immunity was never robustly considered as part of U.S. public health policy, to ask why science wasn't followed. It's essential that we look back and examine the policy decisions that were made. And at the end of the day, science and scientific facts are not political. For a democracy to be healthy, it needs to be transparent. And a transparent, healthy, and free nation does not shy away from the facts. When the COVID-19 vaccines became widely available, 91 million Americans had been infected with COVID-19. Still, facts and science continued to show that those who had antibodies from previous infection had some form of protection against reinfection. Yet, the Biden administration attempted to mandate vaccines regardless of previous infection for the military, healthcare workers, large private sector companies, and federal employees. All around, this is bad public health. Between the mandates and the vitriol showed towards natural immunity, these decisions hurt Americans' trust in public health, a trust that we hope to restore at the end of this process. To be clear, no one ever advocated for a let-it-rip approach. No one ever advocated for natural immunity to be the end-all public health factor, just that it was to be considered. Natural immunity could have been, and I believe should have been, a force multiplier for good. We could have used thousands of years of science to our advantage, but instead it was demonized. This should have been part of a conversation between patients and physicians. And I'll share a personal story. I got vaccinated with the Pfizer vaccine in early January, February of 21, with so many other Americans, especially Americans my age and older and with comorbidities. In August of 21, I realized I must have had COVID when I was cooking and could not smell garlic salt. I was fine, my family was fine, including my 89-year-old mother. All that being said, when I was scheduled to go on a trip to Germany, I was told I needed to get boosted. And so I asked if here at the Capitol, if I could get my T cell count and my antibody levels before getting boosted. I was told that they couldn't do the T cell through their lab, but they could do the antibodies. I got my results. On the results, it says that a number of 40 confirms the presence of circulating IgG antibodies specific for SARS-CoV-2 at high levels. At high levels, 40. My number was 821. Yet I was being told, not by a physician, that I needed to get a booster. Why? No doctor involved. See, public health needs to be educational, not indoctrinational. Why were personal medical decisions left up to bureaucrats and the politicians, not patients and doctors? I do believe that vaccines saved innumerable lives. We knew from the trials that mRNA vaccinated people still got COVID. They, in most cases, did not get as sick and were less likely to be hospitalized. We know that people with certain comorbidities were more vulnerable to severe illness and death. Why did bureaucrats and politicians mislead and confuse the American people? At a town hall event on July 21, 2021, President Biden stated, if you're vaccinated, you're not going to be hospitalized, you're not going to be in the intensive care unit, and you're not going to die. You're not going to get COVID if you have these vaccinations. After the town hall, he stated to a reporter when asked about vaccinated people who get infected, it may be possible, I know of none where they're hospitalized in ICU or have passed away. So at a minimum, I can say even if they did contract it, which I'm sorry they did, it's such a tiny percentage and it's not life-threatening. In May 2021, when asked about new CDC guidance for vaccinated people and masks, Dr. Walensky said, data has emerged again that demonstrate that even if you were to get infected during post-vaccination, that you can't give it to anyone else. On March 29, 2021, Dr. Walensky told MSNBC, our data from the CDC today suggests that vaccinated people do not carry the virus, don't get sick, and that it's not just in the clinical trials. The director added, but it's also in real-world data. Spokesperson for the CDC had to walk back their own director's statements a few days later, telling the New York Times, Dr. Walensky spoke broadly during this interview, adding that it's possible that some people who are fully vaccinated could get COVID-19. The evidence isn't clear whether they can spread the virus to others. We are continuing to evaluate the evidence. In a White House briefing on April 23, 2021, Dr. Walensky offered, CDC recommends that pregnant women receive the COVID-19 vaccine. However, the CDC did not recommend that pregnant women receive the vaccine. It only stated that pregnant women can get the vaccine. While small, those are very different statements. On February 3, 2021, in a White House press briefing, Dr. Walensky stated that schools could reopen safely without vaccinating teachers. She said, yes, ACIP has put teachers in the 1B category, the category of essential workers, but I also want to be clear that there is increasing data to suggest that schools can safely reopen, and that safe reopening does not suggest that teachers need to be vaccinated in order to reopen safely. That time, the White House attempted to distance themselves from Dr. Walensky, with the press secretary, Jen Psaki, stating that Dr. Walensky was speaking in her personal capacity. The Biden administration and CDC's false narratives about the necessity and efficacy of COVID-19 vaccine and booster misled the public with scare tactics and deception. These statements fostered a lack of public trust in our health authority during a time when the American people needed that leadership and that truth and that trust the most. We're holding this hearing today to look back, to help prepare for a future pandemic, to determine what went wrong, to recommend how to do it better. Asking about the reluctance of the public health elite to consider natural immunity is essential to this question. That's what this hearing's about today. Science is clear. While for some, no amount of protection may be enough. However, natural immunity is real, it matters, it should have been studied, and it should have been considered fully. And health decisions should be made on a case-by-case basis based on personal and scientific facts. I look forward to a strong on-topic discussion today. I would now like to recognize Ranking Member Ruiz for the purpose of making an open statement. Dr. Ruiz.
Thank you, Mr. Chairman. Today we are here to examine the roles of both vaccine-induced and infection-acquired immunity, both passive and active immunity, in overcoming a deadly pandemic. This hearing comes at a sensitive time for our nation's public health, as misinformation and disinformation stemming from the COVID-19 pandemic has fueled vaccine hesitancy and undermined the greatest tool we have to protect against infectious diseases, or in fact, the only tool we have that helps prevent against developing symptoms from a natural infection that lead to long-term health effects, hospitalizations, and death, all while reducing overall transmission. It is my sincere hope that we will approach today's hearing with care, and that my colleagues on the other side of the aisle will not draw into question that which we know to be fact, that the COVID-19 vaccines are safe, the COVID-19 vaccines are effective, and the COVID-19 vaccines save lives. Let me take you back to the winter of 2020 before the rollout of the life-saving vaccines. Every day, Americans battled a highly transmissible, rapidly changing, deadly, novel virus. Let me repeat. Every day, Americans battled a highly transmissible, rapidly changing, deadly, novel virus. And at the height of the pandemic, we were losing more than 3,000 of our fellow Americans daily to this lethal public health crisis. More than 3,000 siblings, parents, grandparents, loved ones, and neighbors lost to COVID-19 every single day. These were some of the darkest times for our nation. And so today, as we end the public health emergency, as we look back on the devastation wrought by this virus, we must recommit to preventing future harm and saving lives in the event of another pandemic. This includes looking at how we can build on the Biden administration's implementation of the largest, most successful vaccine administration program in history that allowed us to safely reunite loved ones, reopen schools, businesses, and workplaces, and now declare the end of the public health emergency that we all faced. In fact, according to the Commonwealth Fund, this achievement prevented an estimated 3.2 million deaths and 18.5 million hospitalizations. Plus, it saved the United States over $1 trillion in medical costs. Now let's compare that to the damage that a reckless mass infection strategy would have done to our nation. This strategy would have, at worst, encouraged people to go out and get sick during a deadly, highly transmissible airborne virus, and at best, willfully disregard preventative precautions at a time when we knew little about COVID-19 and its long-term impacts. Even worse, this reckless strategy was embraced by those at the very top of the Trump administration, such as pandemic advisor Scott Atlas, who pushed a dangerous mass infection strategy that would have further strained our already overcapacity national health care system. The strategy that Atlas and others embraced would have pushed already overwhelmed hospital to the brink, led to further delays in care for patients suffering from chronic conditions, and this strategy could have caused an estimated 3 million additional deaths, according to projections by the Washington Post. Look, I'm a doctor, and I took an oath to do no harm. So it's pretty clear to me that we should not reverse course on basic public health measures. We need to defend basic public health in this country due to the politicization and the disinformation and the misinformation that has been putting out there that has caused the mistrust in basic public health knowledge. that have been proven time and time again from previous pandemics and basic science to reduce harm and save lives. Why would we willfully want to allow people, even healthy individuals, to get sick by an active infection that we know very little about, that now we know can develop long COVID, even in patients who have been asymptomatic? And the more you get actively infected, the more the risk that you will get long COVID, as per the science. So because the fact of the matter is, while we can now end the public health emergency because of an overall decrease in hospitalizations and mortality, we must still work to address long COVID and emerging variants, especially for high-risk communities, immunocompromised individuals, and unvaccinated populations. And yet, the continued spread of disinformation, meaning purposefully causing confusion, mistrust, and the misinformation, those who aren't willfully, but they're just sharing this disinformation online about not just COVID-19 vaccines, but vaccines overall, pose a serious threat to this work and our ability to protect America's overall health. I'm concerned that people listening to this hearing will then say, well, look, if active immunity is the way to go, hell, I'm going to go get infected. I don't care about taking precautions. That's not the approach or the message that we should be interpreting from this hearing. So, look, the Brown School of Public Health, Brigham and Women's Hospital, Harvard T.H. Chan School of Public Health, and Microsoft AI for Health have found a growing distrust in vaccines has caused more than 300,000 preventable COVID-19 deaths. What's more, this dis and misinformation has inflicted serious damage on our efforts to combat diseases that we previously had under control, like polio and measles. So this should be troubling to us all. And I'm not speaking here as a Democrat. I'm speaking here as an emergency physician, a scientist who has taken an oath, and a public health expert that has studied public health and practiced public health in the field, who cares about Republicans and Democrats to stay alive, to stay out of hospitals, to not get infected with an active virus. Even though you may have mild symptoms, you may develop long COVID, you may then carry it and transmit it to somebody who is immunocompromised, who is at high risk of getting hospitalized and dying. So for the sake of public health, for the sake of our neighbors, regardless of political affiliation, I implore everyone here today to remain focused on the facts and come together to identify real solutions that put people over politics to prevent future harm, save future lives, and ensure America is stronger and better prepared in the future.